Summit team is one of the teams at Old Town, and our team specifically takes care of the most complex and medically fragile, I would even say most vulnerable patients in the clinic. These people have several comorbidities. Some of them have issues with substance abuse, some of them have mental health problems, and they need some help navigating the healthcare system, extra support and advocacy, and that's kind of what the Summit team provides.
I've been here for several years now, found myself within the traditional primary care model, often turning to my colleagues and just saying, this is really hard to do, to take care of our patients. And I think it's so satisfying to be able to take care of patients that are complex with adequate resources, and it feels like we're able to really meet their needs, and feels like we're able to just feel more satisfied. I feel more satisfied providing care to the most sort of medically, socially, mentally complex patients that we have.
I love working with my patients. I love working with the other staff to really creatively bring all of our disciplines together. We have social workers, doctors, a nurse, a pharmacist, medical assistants that are these beefed up care coordinators, and we all kind of bring our history and our perspective to working with folks and building that relationship together.
I'll take it back a little bit. I've been homeless for 25 years in alcohol and drugs, and I ended up in some trouble and went to jail, and I qualified for this clean and sober program. And my case manager at the program sent me over here to deal with some of my mental issues. They realized I qualified to see the doctor, and I hadn't seen a doctor in years. It's been years. I was always thinking I wasn't going to make it. Each day I wake up thinking this is going to be my last day, with all these medical issues.
I joined the Summit team from the Bridge team. I can't remember when, but I know it was just recently. It wasn't all that long ago. And I did that because it could offer me a better, closer relationship with the people behind my care team, and I could get closer to the pharmacists, and they could come and visit me, and that was all better for me. I have their phone numbers in my pocket. I can call whenever I need to have a voice of concern or to ask for an appointment. That people actually are caring about me and my medical needs, that I'm not just a statistic. And that is very important to me.
I love the aspect of kind of tailoring healthcare services for patient needs. I have a background in street outreach and kind of bringing healthcare to people, and I think that this team really bridges that gap between a really awesome medical center where people can get a broad array of services, but we are oftentimes taking that care and adapting it and bringing it to people still if they need it through home visits, accompanying people to specialty appointments. And so I just love the aspect that we're flexible, we're dynamic, we're really doing what we need to do to meet the needs of our patients.
Instead of expecting our patients to fit into this system of healthcare that we have created, we adapt the system to work for our patients and meet them where they're at, and really strategically use those interventions like you would a friend. Just getting to know them along the way, and then coming in and offering them that support and intervention when you know it fits and makes sense.
I've grown to have the utmost respect and love for these people. they saved my life, literally saved my life. I could never return what they've done for me, and there's no dollar amount or figure that you could put on what they've done. But they've given me a life, and that's more than anyone has ever done for me in all of my life.
The heart of the Summit team is our heart. It's our care. It's our compassion. And I know I'm sounding so sappy, but I mean, to me, this is what it means to be a real human being. It's to care for people, care for others, help others succeed and get the most out of life that they can. I don't know how else to describe it.
It's grassroots medicine. Doctors caring about people and seeing to their care just because they're people and they want to see to their care. Doctors that have taken solemn oaths not to harm, but to care about people, and they do. And we're their neighbors, and this is who they care about. And they went to school to learn about how to care for us, and that's what they want to do. I think the biggest thing they could teach other doctors or the world is to come back to the people. The people is why you got the degrees. Come back to where you wanted to be. That's it.